Hi, everyone, and welcome back to another episode of Conversations with Therapists. Today, we are lucky enough to be speaking to Dr. Terry Crump, a clinical psychologist who works with clients who have chronic illness. Before we get started, I'd love if you could introduce yourself and tell me a little bit about yourself before we continue.
Hi, thank you so much, Shafra. It's wonderful to have this conversation with you. And as you said, I'm Dr. Terry Crump. I am a clinical psychologist. I work in the Atlanta area in Georgia, in the United States. Interestingly, I was trained to work with children and families. Although that's not the work I'm doing now, I end up focusing on working with individuals with chronic illness. But as we have the conversation, it's going to become apparent how that came to be.
Yeah, and I'm sure that, that experience also allows you to move forwards, like with the people that you're working with now. Um,
Absolutely.
So yeah, well, the first question kind of leads into that because it's how you got to work so closely with people struggling from chronic illness and like what brought you into that field.
Absolutely. So I was trained at Bryn Mawr College in Bryn Mawr, Pennsylvania. And the program that I attended was technically both a clinical and a developmental psychology program. So I focused on learning about individuals perinatally all the way to the end of life, if you would. And so, as I mentioned before, I was trained to work primarily with children and families. En route to getting my PhD, I actually became a school psychologist. So I was working within the schools and seeing, various stages of development and things about the educational factors that contribute to how one develops. Once I finished my program, got my PhD, I had the opportunity to do a fellowship at the Children's Hospital of Pennsylvania. And I actually was a psychology fellow, but I was working in pediatric oncology. So
Okay,
this is the entry to health psychology. And
right.
the focus in particular was looking at medical trauma. It was looking at the ways in which a significant medical event impacts children, impacts families, and the long lasting repercussions of that medical event. So I was hired as a fellow to look at post traumatic stress symptoms, not necessarily a disorder, but symptoms that were present for survivors of childhood cancer. And this could have been survivors anywhere from the first year to 20 years down the road. And we started to see patterns. So I was
Wow.
really doing some research. In addition to doing the research, I was a clinical fellow. So I was treating the families. I was tasked to help create and develop a research program that was going to look at what happens from the onset of a diagnosis of pediatric cancer of various sorts. And how does a family navigate that land, both the identified person with the cancer and the family itself? How do they navigate that piece? I was doing the research and we were also developing treatment programs. So I might have been called to, a room and having to meet a family or a child had just gotten the diagnosis and helping them in terms of their psychosocial adjustment to that diagnosis. So this was a wonderful experience. It was a wonderful opportunity. I thought it was going to be overwhelming. I thought I would be depressed. And instead, I was invigorated and I had a lot of life and I felt a sense of purpose. So that was my initial entree to health psychology. And then in my own life journey and personal experiences and members in my own family having chronic illness and having some personal experiences myself, this is how I developed an affinity for this population. And it was a lived experience.
Wow, that sounds so rewarding and also such a natural way to step into the field.
Absolutely.
I think that's amazing. Um, and then moving on to the next question, which is also linked, is sort of how, in your experience, from what you've seen, how does chronic illness affect someone's mental health? I know you spoke about like trauma and
Mhm.
those kinds of things, but what would you say are like the most prevalent issues that people are facing?
The first thing that I want to comment on, in some ways, it's just broad, but it's a way that we don't think of enough, which is that we're multifaceted and multidimensional individuals. And somehow in life, we've come to think of ourselves as bodies or as walking minds, or we talk only about our emotional lives, but we don't always talk about them in an integrated way. So,
Right.
of course, things that are going on emotionally have some a relationship to what's going on in our minds, and or things that are going on in our body has something to do with the way that we're thinking and how we're feeling. And so, if we think about the body as an integrated whole, and we don't separate, oh, I'm going to go over here and I'm going to see my dentist, and I'm going to go over here and then I'm going to see an endocrinologist. But we think of an integrated being that is ourselves. It makes sense how, if we get a medical diagnosis or we're experiencing pain, it has some impact on our emotions. And
Right.
so, thinking about that, and even thinking about the World Health Organization's definition of health, what they've said is that health is the state of complete physical, mental, and social well being. It's not merely the absence of disease. So, if we think about all of the facets, all of the dimensions in which we need to function so that we can be well or feel healthy, it makes sense how one area or several areas impact the other. And I think that is how we can help understand chronic illness and the fact that there may be some difficulty in adjusting to or navigating that area or those diagnoses, those sets of experiences.
Right. And I think if we step in a little bit to medical trauma and also like building upon what you just said, I think a
Mhm.
lot of times if there's not a clear-cut diagnosis at the beginning, there's a lot of dismissal that goes on. And I think a lot of times that idea of like the body and mind being together isn't always noticed like within the doctor's office. So it's sort of like, oh, well, you're very stressed, so this could be the cause of all of your problems, or you're anxious, so maybe that's why you have pain. And I think that's also just important to note that like that could also be problematic down the line when somebody eventually does get the diagnosis. But for a long time they've been so dismissed. So I guess how can you help clients who have been dismissed by doctors for so long, maybe if they're still pre-diagnosis or that post-diagnosis, but they're still trying to come to terms with the dismissal that they had and also this new diagnosis that, could potentially be life-changing.
Absolutely. There are a number of things that I think about as you're talking about struggling to find a diagnosis, feeling not heard and invalidated. First is that you're looking for validation. So, in the medical community, I think that we're starting to move towards having integrated systems. And by integrated systems, not just individuals in the medical with a medical degree per se, but we're starting to think about, okay, behaviorally, do we need to bring in a behavioral health professional? Do we need to ensure that we have adequate resourcing? So we might have social workers involved. And we're starting to compile teams of individuals to work within one system. For some areas that's new, for some systems that's new. And I find that children's hospitals in particular tend to think this way in that they have
Yeah.
interdisciplinary teams. I think it's less so at the adult level, but we're starting to use that model. So that model is being extrapolated to a older population. That's going to make it easier going forward for us to continue to be able to pinpoint all of the factors that are helping to explain a particular diagnosis. Um, so one of the things that I want to point out is that we tend to try to have discrete um, explanations, discrete explanations for why something is going on, as opposed to having a more complex explanation for what's going on. If we looked at the various factors that are contributing to why something is showing up, I think that would be helpful. To the point of being dismissed by other medical professionals, um, it's important to look for a system that's going to be more sensitive, one that's going to be more open to hearing about what is one's experience and then trying to understand what's going on. And so it might take some searching. It might be exploring what are the options or who are the various professionals who seem to have more of an integrated approach and to be more open to listening to the individual, the party and their experience, and then seeking to identify the factor or factors that are contributing to the presentation. I think that's a way that you might get at finding a diagnosis or explanation to help.
Yeah. And I think one of those steps that people can take is, of course, going to therapy and seeing a professional in that way.
Mhm.
And from your experience, working with clients who, have had a huge range of experiences within this sort of field of chronic illness, how does therapy then come into play? How does that help people who are struggling to cope?
You know, what would be helpful is if, let's say that they start in the if the system is not integrated and they don't naturally have behavioral
Yes.
health professionals there, what would be helpful is if we're starting from a medical system that's delivering a diagnosis, it would be helpful for that medical professional to widen the lens and help the individual, the patient or client, him or herself, to recognize that it's not just something going on in your body, but it's something also going on in your mind. That's not a way of dismissing what's going on. It's recognizing that there are psychological components to absolutely everything, just as there are physiological components to everything. So, medical professional could be the one providing some education. It's helpful, or it is often helpful for people receiving this diagnosis to start to explore the ways in which this might impact their coping, their psychological functioning, and their physical functioning. That medical professional can suggest having conversations, and conversations can be just that, a consultation. There are people that come to me just for a one-time conversation so that they know here are the markers of things, that the range of things that might happen. These are the signs when I'm out of the realm of adaptive functioning and I'm moving into less helpful functioning.
Right.
I think if we can take that approach of you've received a diagnosis, perhaps having a consultation with someone who looks at how people cope with these diagnoses can be helpful. That would be a good way for us to partner with our medical professionals. And similarly, people coming in to see me, I might say, I want to ensure that we haven't missed any physiological
Mm.
markers for why you're having difficulty sleeping or all the other symptoms. Let's make sure that you have a medical workup, that we're looking at, your levels, your vitamin levels, a number of things. And then let's come back, let's regroup and have the conversation. And I typically do that in my practice. So I think there's a way that we should be working closer together with our medical professionals working with behavioral health professionals to ensure that we're really working with the whole person.
Mm. I think, like, as you were saying that, I was really thinking how it all circles back to that feeling of validation. I think even if people are coming to you, just for one time, but to really understand
Yes,
that there's more to it than just one thing, and that
absolutely.
that sounds really, really important for people to know. And I feel like we've covered, really important things right now, especially like in terms of your answers to the questions. There's so much that people can take and kind of learn, like, if they're struggling as well. But lastly, I just wanted to ask what advice you could give to people who might be feeling hopeless right now or lost due to their chronic illness, and how can they take, even if it's small steps, how can they take small steps into feeling better?
The first step, I think, is to recognize that you're not alone. I hate to say that because it's sort of cliche,
Yeah.
but the truth is that when you start to even make a call to someone that is more apt to hear you, you don't want to make a call to someone who tends to be dismissive, and you know who they are.
Yeah.
But the person that's likely to hear, chances are that person is going to say, I wonder if there's a community. I wonder if there isn't another person in your community in the world. Our world is smaller. We can
Yeah.
reach around the world now. We're having this conversation virtually. We're in two different areas of the world, you and I right now. And
Right.
so that's the thing, finding a community of individuals who might have similar experiences as you, so that you can be validated. It's not just trying to have a yes person. It's truly finding a community that might say, yeah, this is consistent with my experience, or no, it's not. But the chances are that you are going to feel validated by finding others who have similar experiences. That's one step. Another step might be to find individuals who love you, who are willing to have conversations and to truly listen without trying to fix it. There's a place for fixing things, but first you need to be heard fully. So I'd say reaching out to those individuals in your immediate community who are going to listen first so that you can feel that, oh, okay, someone actually cares. And then another step might be having a conversation with medical professionals. And when I say medical professionals, I mean both those that attend both to the physical self and or to the psychological self. Reaching out to someone who might be able to help you navigate what it is that you're experiencing. So I'm suggesting several different steps. One is to first have conversation with those who are similar to you, conversation with those who are loved ones, and then thirdly, having conversations with professionals who might be able to help you to navigate the road. You might end up talking to someone like myself.
Yeah, I think that both of those things could be extremely helpful for anybody who feels isolated or confused even, or doesn't know what's happening, because there's, especially when it comes to, speaking to people who have similar experiences, that's such a great way to, just feel less alone. I want to thank you so much for coming on Conversations with Therapists today. I think a lot of people are going to learn a lot, and hopefully this conversation will help people and give people the tools to get the help that they need, if they need it.
Thank you so much, Shifra. It is a topic about which I'm passionate. You probably saw some of that passion. There are 50 million thoughts that were crowding my mind. I didn't even know how to organize them, but I'm really, really committed to this community, and I look forward to future conversations, hopefully.